This is your Sunrise. Sunrise.
You're on Sunrise Radio with me, Shabnam Sahi. It gives me great pleasure to say a big warm hello to Professor Sanjay Sharma, CRI's Consultant Cardiologist and Professor of Sports Cardiology and Inherited Heart Conditions at St. George's University of London. Professor Sharma, welcome to Sunrise.
Nice to talk to you, Shabnam.
Now, you've had a phenomenal career in your chosen field. You are held in very high regard. You've published books, you've written papers, you've given lectures, and you're truly passionate about this charity. Now, we've been running advertisements on the station. We've been trying to make people aware of what CRI is, what it does. Let me ask you this. When and how did you first become involved with the charity Cardiac Risk in the Young, or CRI? I believe you go back about 20 years. Am I right?
Yes, I first became involved with CRI in 1996 when I was a middle grade doctor at St. George's Hospital carrying out research in heart muscle diseases that cause death in apparently young, healthy people, including athletes. At that point, I met a great woman called Alison Cox, who was the former chief executive of Cardiac Risk in the Young. And she was committed to diagnosing silent heart diseases in young athletes because these are the sort of people that made the newspapers. She had links with the Lawn Tennis Association, who were the first sport to start testing their athletes in this country. As time went on, we tested several other sporting organizations, and my research allowed me to identify specific patterns on relatively simple cardiac tests, such as the ECG, that could detect sports people with serious heart diseases. Now, Alison was also a bereavement counsellor and was receiving hordes of calls from traumatized parents, siblings and spouses that had lost young family members. So we decided at this stage to look into the number of cardiac deaths that occurred in people under 35 years old in this country. And I was quite staggered when it became clear that there were at least 600 deaths in England and Wales each year. That's around 12 per week. And it doesn't sound like a lot, especially with this COVID-19 pandemic. But if we consider that each one of them lost between 50 and 70 years of life, then it becomes a very tragic statistic. And over the past 20 years, I noticed that we've made major strides in reducing heart disease in the UK, and this has resulted in fewer heart attacks and fewer deaths from heart disease. But these benefits have really only been translated into a longer lifespan in middle-aged and older individuals. We've not really done very much to reduce the risk of sudden death in young people. They've remained the same. And if we look at people or we interview people who have lost loved ones, they'll tell you that their loved ones never complained of symptoms and sudden death was the first presentation. We also knew that the things that cause sudden death in sports people are the same as those that cause death in non-sports people because most of these conditions are genetic and your genes have been determined before you do any sports anyway. So we thought we could try and roll this out. The stuff that we were doing in athletes, we should roll this out to the young British population. We'd already got algorithms that we could use to identify these people. And so we started doing that, and to date, CRI have tested around 220,000 people. That's about 32,000 people a year. And we found so many important things which just fueled my passion. I found that 1 in 300 young people in this country who have no symptoms at all and feel really well had a heart condition that could potentially kill them. So we diagnosed around 700 of those people, and the questions are, well, what happens once you diagnose them? Well, we found that 60% of those people that get diagnosed get some medical intervention that would have never been considered because they would have never been picked up. We also found out that most people that die from electrical faults that are relatively straightforward to pick up on a simple electrical tracing called the ECG. And although our government doesn't necessarily promote that every single young person in the country gets screened, what we did do is we did an economical analysis to see how much it would actually cost if we tested everyone and then had to do further investigations before we made a diagnosis. And we worked out that if we did the CRI model, it would cost about £55 per individual. And this sort of data could inform future policies that if someone was worried about their health, they were young, fit, wanted to be tested, and the NHS couldn't offer this, they could probably pay for themselves and get themselves screened and be more comfortable about their future, if they were playing sport, if they were about to have children, and all sorts of other things.
Yes. So as I understand, this is actually, as you're saying, collecting a lot of data over the years and then kind of reading what it is trying to say to you, right? That is what you have painstakingly done over the years and the decades. Now, Professor Sharma, talk me through your personal journey as a celebrated cardiologist. Why did you specialize in heart conditions, and why were you drawn to athletes in particular? Is it because you were getting, as you said, a staggering number of cases from those who were playing various sports?
Well, I decided to do, I love medicine. So as I went through my training path, every time I was attached to a particular specialty, I thought I was going to become a specialist in that field. But it was when I was about 25 years old and I was attached to a cardiac team, I realized the dynamic nature of cardiology. It was very clear to me that the vast majority of patients that come to the accident and emergency department usually have heart conditions. Cardiology was dynamic. You had to use your brain, but you also used your manual skill in putting in pacemakers, doing angioplasties, and it made a massive difference. Yeah. And so I decided to do cardiology. And clearly sport is lots of people's passions. I loved playing football, cricket, running, and what used to grab me as a junior doctor was when I'd hear about some amazing football player that had just dropped dead. He was absolutely fine. So that's what got me interested in heart muscle diseases, and that's how I got involved with CRY. And that was probably one of the best things that's ever happened in my career, really getting involved with CRY, because it then allowed me to lead one of the largest, well, it probably is the largest cardiac screening program in the country for young people. I made several connections with sporting organizations to try and identify what sport does to someone's heart and how we can tell the difference between these physiological changes that are good to allow the heart to do a good job when you're training versus those that may cause sudden death. And with that, I then started working with the London Marathon. I became the medical director of the London Marathon.
So clearly it is something that you're passionate about and you were drawn to, as you're saying, looking at these cases that came to you. And I've done my homework. I've seen the kind of work you've done, the kind of organizations that you collaborate with, that you've helped, and it is absolutely amazing. I'm in conversation with Professor Sanjay Sharma, CRY's Consultant Cardiologist and Professor of Sports Cardiology and Inherited Heart Conditions at St. George's, University of London. Our chit-chat will continue on the other side of the break. Keep it Sunrise.
The greatest Asian radio station in the world. Sunrise Radio.
You're on Sunrise Radio with me, Shabnam Sahi. I'm in conversation with Professor Sanjay Sharma, CRY's Consultant Cardiologist and Professor of Sports Cardiology and Inherited Heart Conditions, and this is at St. George's, University of London. Now, Professor Sharma, let me ask you this. Why is it so important for young people to have their hearts screened? Even those who may not be passionate sports people or not really pursuing sports on a professional level. Why do you think it is important for them to avail of this service that exists?
I think it's very important for young people to have their hearts tested, simply because young people feel they're invincible, and rightly so. Very few young people would have to go to their general practitioner. In fact, most people don't have to attend a general practitioner until they reach their 50s, unless they're going for immunizations, unless they're pregnant or are unfortunate enough to have chronic medical conditions. So these young people are sitting there without any chest pains, any breathlessness or blackouts that would warrant an admission. And suddenly, one of these people go to bed one night and never wake up in the morning. And if one considers that around 60%, maybe more, 70% of all deaths that we see in young people due to heart diseases can be diagnosed during life, and for which there are several medical interventions that can reduce the risk of sudden death or even change the natural history of the cardiac disease they have, then I think it's a bit of a no-brainer that someone should not have these investigations. Clearly, the NHS is burdened with lots of other things. They're looking after, our middle-aged and older individuals, trying to tackle obesity, high blood pressure, diabetes, and all the other things that are so important to minimize the risk of heart attacks, amongst the Asian population particularly. And so there isn't much funding for these young, healthy people. And we have already determined that screening young people with a relatively simple test called the ECG, which is an electrical tracing of the heart, will identify serious diseases in a significant proportion, and this identification will lead to either drug therapy or even curative therapy in the form of what we call radiofrequency ablation. If you're born with an extra electrical wire in the heart that could cause trouble, we could get rid of it. And even if we cannot cure it, we can provide lifestyle advice that would protect that person from sudden death. You know, we give all sorts of advice about certain medications that they should avoid. Some conditions you should avoid sitting in a sauna room or steam room for a long time.
Are you suggesting that this should be something that young people should consider doing as a matter of routine, just as you get your jabs? I mean, or is it only something that you consider when you've had cause for concern, no matter how small that cause for concern might be?
Well, let's start with the cause of concern. I think any young person in this country who is experiencing chest tightness during exertion, who feels they're far more breathless than they should be when they're running around, who's experiencing palpitation, that's a rapid racing in the chest, or who has blacked out. These 4 conditions are cardinal features of potentially serious heart disease. These people should not be sitting on these and ignoring them. The other thing that all young people should be aware of is that the vast majority of conditions that cause sudden death in young people are genetic. So if there is a family member that has either died or developed a cardiac condition under the age of 40 years old, that raises the possibility that there may be a genetic fault in the family, and those members should be tested. For all the remaining, the fit and apparently well people, my advice would be that it's a small price to pay to have yourself tested. Now, I'm not saying that this should be done through a very expensive private organization, which is very costly, but they could use this charity, Cardiac Risk in the Young, which is a non-profit making charity, and I'm not trying to plug it at all. I'm just saying that the charity does these tests at a very, very subsidized cost of around £50 a week. In fact, there are £50, I meant. There are certain times a month, I think twice a month, where these tests are conducted free of charge on a weekend at St. George's Hospital. But once you are picked up with something, that's not the end. The charity will see you through to the final diagnosis, and that's where our sports cardiology and inherited cardiac conditions clinic becomes important, because we run a one-stop shop. So once CRI have picked someone up, they can be referred to a group like ours, and we will take them through all the investigations on that day. So that individual leaves our hospital either with a diagnosis and a treatment plan, or some form of reassurance that we haven't found anything. So it's a good service.
Fantastic. Now, Professor Sharma, we know what they say about things like diabetes. When it comes to the heart, do you think young people from a BAME background are more susceptible?
I haven't really been able to convince myself about that in young people. It's true to say that certainly our middle-aged and older population is at risk of diabetes. Diabetes is a major issue amongst the Asian population. So is obesity. So obesity and diabetes play a very major role in cardiovascular disease in our middle-aged and older population. But I do think that exercise is absolutely crucial, and everybody should be doing exercise. And this is why I feel people should be protecting themselves before they take on very intensive exercise. But exercise really is the answer for most medical conditions. If our youth exercise, remain fit, they will their body mass indexes will be lower. They're less likely to get diabetes and less likely to have heart attacks when they get older. But just to answer your question, there is very little evidence to suggest that the BAME community are at a higher risk of cardiac disease in their youth.
Now, you mentioned earlier in the conversation that CRI usually screens around 32,000 young people every year. And this program was naturally halted during lockdown, which means that by the end of September, around 15,000 young people will have missed their appointments for a free screening. When do you think, or rather when do you hope, the CRI screening program will be able to resume again post-COVID-19?
That's an interesting question. I'm not sure exactly when the full lockdown will be lifted. And we've got to be guided by the government and adhere to their stipulations. There were, certainly in London, things are definitely much better. The R value for COVID-19 infection is now down to below 0.4. Certainly as a doctor working in the NHS, we are seeing less and less admissions with COVID-19. The intensive care units are no longer fully occupied with COVID-19 individuals, so the situation is looking bright. But what we don't know at the moment is whether there's going to be a second wave with COVID-19. And what we have to do, of course, with the CRI screening programs is balance the benefits of young people knowing they may have serious heart conditions with those of mass gatherings and maybe developing COVID-19, which could end up to be a much worse situation.
Worse situation, absolutely. Professor Sharma, thank you so much for your time. Before you go, one last question. You know, I was looking through your blog, the one that you do for CRI, and I can see that you're clearly a family man. So are your daughters following your footsteps into science and medicine? What is it like at home?
Well, I've got two daughters. One's 22 and the other one's 21 years old. And clearly I love my job. I love medicine. And I was hoping that one of them would do medicine, but I didn't want to push it on them. It was medicine's something that has to come from the heart and not from the head. You need to want to do it. It's not an easy career. So when my eldest daughter turned about 17 and said she actually wanted to do medicine, and I said to her, look, darling, are you doing this because of daddy, or are you doing this because it's coming from the heart? She says, no, it's coming from the heart. And she studied at Imperial and she's doing so well. She's so passionate about medicine. So I'm very, very pleased that she has decided to do medicine. I'm not trying to shape her career anyway, but so I was so proud when she said,
and I'm sure it must have helped the fact that she has daddy at hand to ask to answer all her questions rather. And I can only imagine the kind of discussions you might have at the dining table. Fantastic. I was in conversation with Professor Sanjay Sharma, CRI's consultant cardiologist, also a professor of sports cardiology and inherited heart conditions at St. George's, University of London. Professor Sharma, it was a delight speaking to you. Thank you so much.
Thank you very much for having me on the show.
Thank you.
This is Your Sunrise. Now on Crystal Clear DAB.